our project is changing the opinion and policy of Macedonian government to accept the drug addiction as an illness. So the justification is that drug users are seen as outcasts and in society and treated as second-class citizens because of the stigma that the drug user has as an addiction. So drug users aren't able to access the necessary funds to help them with their illness because of the law associated with addiction rather than with it being an illness. And we'd like to change the opinion by changing the policy at the parliamentary level, at the governmental level, from addiction to illness. And as an illness, the drug users will qualify for necessary medical treatments to help them get and stay off drugs. The actions of the project are to educate and change the opinion of key policymakers in the Macedonian government to accept the drug addiction as an illness. So basically what we're going to do is the key policymakers are going to tour the existing Macedonian therapy centers. Then they're going to travel to Poland to see how the therapy centers are there. Then they'll have roundtable discussions with key policymakers between the Macedonian government and the Polish government. Then we're going to translate and adapt the Polish law to the Macedonian law. We'll educate the Macedonian parliament to adapt the model of the Polish policy into Macedonian law. And then also at the very end, to sustain it, we're going to start a team for phase 2 of the project to strengthen the capacity of healthcare workers. So the goal is to change the opinion of the Macedonian government. The specific objective is that the policy change and education of key policy officials on the subject of drug illness and awareness. The indicators are that educate the Minister of Health and Social Affairs in Macedonia to understand the Polish model and opinions of the policy of the therapy community and hold roundtable discussions. So the result is the existing policy will be adapted by the Macedonian government. And within 6 months, we think this is possible for all of this to happen, for the networking, the roundtables, the translation, and the adaptation into the Macedonian law by the Macedonian lawyers. Our partners are Director of Therapeutic Community in Poland for drug illness. Their role is to arrange meetings with the Polish Ministry of Health and Social Affairs to make presentations about the Polish legislation and policy. And then our Macedonian Center for Drug Awareness and Policy Change, the role is to facilitate and coordinate the Macedonian ministers, coordinate the team for translation, coordinate the team for education, and coordinate the team for the next phase. So we're responsible for coordinating all that.
If you have any questions, I'm expert on the field of drugs. You can ask something additional.
And drug rehabilitation, hopefully. Yeah. The other involvement is the Ministry of Health and Social Services in Macedonia, Ministry of Health and Social Services in Poland, the Polish Center for Policy and Change to facilitate the implementation process. There's 5 therapy centers in Macedonia and 5 therapy centers in Poland. We have translators, administrators, and lawyers, and we also have experts in the therapy community. Here is the rough budget. Our share is 15% from Macedonia. We will actually ask the Macedonian government to contribute a large portion of that 15% because it does affect their citizens. So obviously there's traveling, there's the wages for experts, there's coordination of project and staff, there's the accommodations in Poland, facility for the roundtable and education, the visibility, which we're going to do on a website, and we'll have the process available throughout. There's translators, lawyers, administration, there's the tour of the Macedonian Therapy Center, the Polish experts, monitoring process, evaluation process, and the contingency plan.
Long years, I'm sorry, I want to add something. For long years we are working on this issue, so our organization has the capacity and also the experience. So we have these contacts here written for real. So I just wanted to mention that.
Good, thanks. Is there anything else that you want to add?
No.
Okay, great. Do you have any questions from the audience?
Yes, I want to ask. For me, it's not clear how will they educate the Ministry of Health Polish law? I mean, how will be their influence to the Ministry of Health here in Macedonia?
We would like to present to our government a new model for a new model for looking on addiction, on drug addiction. We would like to show them how positive is to look on drug addiction as an illness, not just as an addiction. And I think that when our minister make a tour to Macedonia through our centers dealing with drugs, and when he make a little tour through Poland and see how institutions there are functioning, I think that he will change his opinion and he will accept the drug addiction as an illness, not just like addiction.
Also through the roundtable discussions in Poland, not only touring the facilities, but also the roundtable discussions and the experts, the experts in Poland who have already implemented this, who have already done this, they'll be there to discuss and to show them how the framework happens. Is that your question?
No, for me it's like we like organization, we cannot influence to the government in this kind of part. I think that it's better to like organization to work on field, and in this way to make some changes in the local level. I think so.
What we're proposing is that we do it at the parliamentary, at the governmental level, and then have it after that come down to the local level. So if we start from the top to change the government, the policy, and then we can start to work within the communities with, like I said, phase 2, to work with the doctors and nurses to get them in a higher capacity. So we're proposing the opposite, to start from the top and work down.
We want to reach the persons who can change something, the persons who has authority to change something, because we do not have as an NGO.
Anybody else have questions?
Any other question? No, apparently not. So